If you're an older man and you masturbate, I want to ask you something important. Have you ever stopped to wonder if it's still actually healthy once you're past 50 or 60? Maybe you've had some quiet concerns, questioning whether it could be causing harm you just can't see. If you've ever felt that way, you're definitely not alone. This topic is full of confusion, outdated ideas, and very little clear, trustworthy information. It's one of the most common but rarely discussed concerns for men as they get older. And once you start digging into the facts, it's easy to understand why so many men feel unsure. Studies reveal that most men over 60 continue to masturbate, but many do so without really knowing what it might mean for their body. There's uncertainty around hormones, prostate health, and even how it might affect their sexual performance with a partner. That's exactly why we're going to have an open, honest, and science backed talk today. I want to walk you through 10 benefits of masturbation as you age, things that might surprise you, and then 10 possible risks you really should be aware of. It's all about helping you make sure this part of your life stays healthy. So let's start on a positive note. Let's look at what masturbation can actually do for you in your mature years. First, it keeps your penis healthy. When you get an erection, blood flows into the spongy tissues of the penis, what's called the corpora cavernosa. This flow acts like physical therapy for your member. That regular movement helps keep the tissue elastic, which is super important for maintaining firm erections as you age. Second, it supports prostate health, which is a big deal. Some large studies, including one from Harvard, have shown that men who ejaculate more often have a lower risk of developing prostate cancer. The theory is that it helps clear out harmful fluids or substances from the prostate. Third, it strengthens the pelvic floor. During orgasm, certain pelvic muscles contract, like the pubococcygeus muscle. These muscles are key for things like stronger erections, better ejaculatory control, and even preventing urinary leaks. That's especially helpful as we age. Fourth, it helps reduce cortisol, which is the main stress hormone. Orgasm leads to a noticeable drop in cortisol levels, which in turn helps keep blood pressure down and anxiety under control. So it's not just a physical release, it can actually support your mental and heart health too. Fifth, masturbation releases a wave of feel-good brain chemicals. You get a rush of dopamine, the pleasure and motivation chemical, and oxytocin, which is often called the bonding hormone. This combination gives you a lift in mood, a sense of well-being, and even emotional closeness with yourself. That's a huge mental health booster. Sixth, it helps you detect physical issues early. Masturbation gets you familiar with your body, so you're more likely to notice if something feels off. This kind of self-awareness can help catch things like testicular lumps, penile curvature, or other early signs of illness. Seventh, it helps improve your sleep. After orgasm, your body releases oxytocin and prolactin while cortisol levels drop, which puts your body into a deeply relaxed state. That makes it easier to fall asleep, and not just any sleep, but the deep, restorative kind that becomes harder to get with age. Eighth, it boosts blood flow in the whole pelvic area, not just the penis. That better circulation supports bladder function, keeps the prostate healthy, and nourishes the surrounding muscles and tissues. Ninth, it can be a kind of personal training for better sexual performance. If you struggle with premature ejaculation, masturbation gives you a way to practice techniques like the stop-start method in a private, safe setting. Over time, this can help you learn more about your own body's timing and build better control, which can improve your experiences with a partner. 10th, it helps keep your sexual brain active. The brain is your biggest sex organ, and engaging it regularly through fantasy or physical touch keeps your desire alive. This keeps your arousal pathways firing even if you don't currently have a partner, which is important for maintaining a healthy sex drive. But in order to truly support your health, you need a full picture, not just the good stuff. Masturbation should be something you do with awareness. So now let's talk about 10 potential downsides that you need to watch for. First, it can lead to social withdrawal if it starts replacing real connection. Masturbation should be a healthy part of your sexual life, not a way of avoiding intimacy or isolating yourself. The solution here is being mindful. Make sure this habit adds to your life, not takes you away from it. Second, there's the risk of skin damage. If you masturbate too aggressively or don't use lubrication, it can lead to tiny skin tears, what doctors call microlesions. These can cause pain, irritation, and even lead to infections. It's an easy fix. Be gentle and always use a good, water-based lubricant. Third, there's the risk of becoming too used to one specific kind of stimulation. If you always use the same speed, pressure, or motion, your brain might start only responding to that exact type of touch. That can make it harder to enjoy intimacy with a partner. The key is to switch things up regularly. Fourth, it can cover up deeper health problems. If you can get an erection when you're alone, but not with your partner, it's tempting to ignore the issue. But that could be your body signaling a bigger concern, like early signs of heart trouble, diabetes, or low testosterone. Don't ignore it. If this sounds like you, it's time to talk with your doctor. And before we continue, I want to take a second here because this next part could really help. While this video helps explain what's happening, there's a powerful free video I want you to check out that explains why it's happening and how to fix it naturally. It walks through a 7-second home trick that targets what new research says is the real root cause of poor sexual performance in older men. This isn't about pills or quick fixes. It's about helping your body work the way it's supposed to. You can scan the QR code on the screen right now to see that video, or click the pinned link in the comments below to watch it after we're done here. Trust me, it's worth your time. Now let's get back to the rest of the important risks you should know. Fifth, masturbation in a bad position, like slouching in a chair, can lead to nerve problems. Sitting for long periods, especially if you're hunched over, can compress the pudendal nerve in your pelvis. Over time, that can cause numbness or pain in your genitals. To avoid this, try lying down in a supported, comfortable position when you masturbate. Sixth, it can become an emotional crutch. If you're using masturbation every time you feel bored, anxious, or down, it might turn into your main way of coping. That can create emotional dependence. It's important to have other ways to deal with life, like going for walks, talking to someone, or even meditating. Seventh, many men deal with guilt or shame around self-pleasure. Maybe it's because of what you were taught growing up or religious beliefs. If these feelings still bother you, it's a good idea to speak with a therapist who understands male sexuality. You don't have to carry shame about something natural. Eighth, there's a condition called pelvic congestion. While not ejaculating enough has risks, doing it too often, especially multiple times a day, can cause aching or a heavy feeling in your testicles or pelvic region. The answer here is balance. Pay attention to what your body is telling you. Ninth, it might temporarily lower your sperm count. This only really matters if you and your partner are trying to have a baby. Ejaculating every single day can reduce sperm concentration for a short time. If you're planning to conceive, research shows waiting 2 to 5 days between ejaculations gives you the best sperm quality. And finally, 10th, there's the issue of losing touch with real experiences, especially if you're watching extreme or unrealistic porn. That kind of content can warp your expectations and make real-life intimacy feel less satisfying. Try using your imagination more often, or thinking back to actual memories that meant something to you. So now you can see, masturbation after 60 isn't all good or all bad. It's a tool. And like any tool, it depends on how you use it. When done with awareness, care, and a sense of balance, it can be an amazing way to support your sexual and overall health. I truly hope this conversation helped clear things up for you. I'd really love to hear what you think. Was there something today that surprised you? Drop a comment down below. I read them all. And if you got value from this video, don't forget to hit the like button and subscribe for more clear, judgment-free advice about men's health. Stay well, and I'll see you in the next one.